Hey, are you having fun?
Uh-huh.
Gonna have some lunch?
I want to go play.
How about you eat a couple of grapes and then you can go play?
Okay.
Gee, what's going on? Are you choking? Come here.
Choking can occur when a solid object, such as a piece of food or small object, enters a narrow part of the airway and becomes stuck. Young children are particularly at risk for choking because of the small size of their air passages, inexperience with chewing, and a natural tendency to put objects in their mouths. On inhalation, the object can be drawn tighter into the airway and block air from entering the lungs. A forceful thrust beneath the ribs and up into the diaphragm can compress the air in the chest and pop the object out of the airway. You must be able to recognize the difference between a mild blockage and a severe blockage.
With a mild blockage, a person can speak, cough, or gag. This type of blockage is typically cleared by coughing. Encourage someone with a mild blockage to cough forcibly.
Stay close and be ready to take action if things worsen. When a severe blockage occurs, a child cannot dislodge the object on her own. Signs of severe obstruction include very little or no air exchange, lack of sound, and the inability to speak or cough forcefully. The child may hold her hands to her throat as she attempts to clear an obstruction naturally. Your help is required to save the child's life. To care for a child who you suspect is choking, begin by asking, "Are you choking?" If the child nods yes or is unable to speak, cough, or cry, act quickly. Stand or kneel behind the child. Reach around and locate the child's navel with your finger. Make a fist and place the thumb side against the abdomen, just above the navel and well below the ribs. Grasp your fist with your other hand. Give a quick inward and upward thrust. Repeat thrusts until the child can breathe normally. Each thrust needs to be given with the intent of expelling the object. If the child becomes unresponsive, gently lower her to the ground. Have someone activate EMS and begin CPR. Look in the mouth for an object after each set of compressions before giving rescue breaths. Remove any object if seen. If you are alone, perform CPR for about 2 minutes before activating EMS yourself. Continue until the child shows obvious signs of life or another provider or EMS personnel take over. Infants who are choking are managed differently than children. Since infants do not speak, it may be more difficult to recognize choking. A sudden onset differentiates it from other breathing emergencies. Signs include weak, ineffective coughs and the lack of sound, even when an infant is clearly attempting to breathe. If you suspect an infant is choking, act quickly. Straddle the infant face down over your forearm with the head lower than the chest. Support the head by holding the jaw. Using the heel of your other hand, give 5 back blows between the shoulder blades. Next, sandwich the infant between your forearms and turn her onto her back with legs and arms straddling your other arm. Place 2 fingers on the breastbone just below the nipple line and give 5 chest thrusts. Repeat back blows and chest thrusts until the infant can breathe normally. If the infant becomes unresponsive, gently place her onto a firm surface. Have someone activate EMS and begin CPR. Look in the mouth for an object after each set of compressions prior to giving rescue breaths. Remove any object if seen. If you are alone, continue CPR for about 2 minutes before activating EMS yourself. For a choking adult, the approach is nearly the same as for children. Stand behind the person, reach around and locate the navel with a finger. Make a fist and place the thumb side against the abdomen, just above the navel and below the ribs. Grasp your fist with your other hand. Give a quick inward and upward thrust. Repeat thrusts until the person can breathe normally. Each thrust needs to be given with the intent of expelling the object. If the person becomes unresponsive, carefully lower her to the ground. If not already done, activate EMS. Begin CPR, starting with compressions. Look in the mouth for an object after each set of compressions before giving rescue breaths. Remove any object if seen. Direct compression of the chest over the breastbone can also create enough pressure to expel an object. When someone is clearly pregnant or obese, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the person. Reach under the armpits and place the thumb side of your fist on the center of the chest. Grasp your fist with your other hand and thrust straight backward. Try to not put pressure on the ribs. If you are alone, try pressing your abdomen quickly against a rigid surface, such as the back of a chair. Abdominal and chest thrusts can cause internal injury. Anyone who's been treated for choking with these maneuvers should be evaluated by EMS or a physician to ensure there were no injuries.